Hello and good morning, everyone. Welcome back to Eldercare's training series. I'm Adrienne Ostras,
And I'm Melanie Limpy.
and we're super excited to have our guest back again. This might be their third or fourth time on with us.
Wow.
And it's really important that we keep doing these same topics because this is a product that is very different than all of the others out there. So if this is something that you haven't attended this training before and you have no idea what an innovative plan G is, don't worry, we will explain it to you. And if you have been on before, which I see some familiar names on, maybe you've been on one of these before, but that light bulb moment just hasn't happened yet on how to position this type of plan G. We will definitely be going over that as well. And if you have questions, find the Q&A box. So if you're on Zoom, the chat is disabled. So just find the Q&A box, and that is where you can ask your questions. But without further ado, let's introduce our special guest. Do you want to intro?
You go ahead.
Okay.
She's better.
We'll intro our special guest. It's Physicians Mutual, and we have three guests with Physicians Mutual with us this morning. We have Robert Davis, Sandy Higdon, and Mike Story. Good morning, guys.
Good morning. Good morning.
Thank
Good
you
morning,
so much for
everybody.
taking the time to talk to our agents about this innovative Plan G. I know it took me maybe two or three webinars to quite get it.
So this is the plan that has the disappearing deductible with the lifetime discount. Did I say
Yes.
that right? Okay.
Yeah.
Melanie's got it down.
Yes.
Well, but I'll let you guys kind of intro yourselves and kick this thing off.
Okay. I'm Mike Story. I'm the National Sales Training Director here at Physicians Mutual, and I've been here for 33 years now. So thank you for having us.
Wow. Yeah, that's a long time. So you must know some things.
Yes.
Oh, a little bit. And then we have Regional Sales Director Sandy Higdon with us. Thank you, for joining today, Sandy. And Account Manager Robert Davis, which you guys all are familiar with. He's very good at what he does.
Awesome. Well, yeah, thanks everyone for jumping on. I'm glad that we got Mike back in front of the group because he is, I don't know if he started with the idea of the innovative, but I feel like he's the one that created the system and he knows everything about it. He was there from the beginning, and also Sandy Higdon. So we're going to let Mike jump in and start explaining the innovative G.
Okay. Well, thank you. Ladies, can I share?
Yes. Yeah, you are good to go.
I'm looking at the top and it says view, recording, sign in. I don't see, unless this is a different version of.
You might have to hover on the bottom to see the share option.
Okay, there we go.
Yeah.
There is our share option. So let me do a little bit of sharing here with you. And let's talk about this innovative. Now, a lot of people throughout the industry always say, Mike, what is this plan? What is this innovative? It's funny, I hear people say they call it an innovative thing, like it has arms and legs or something like that, but it doesn't. It's one of the only patented Medicare supplement plans in the business. And one of the things that we see and what we all are hearing in our industry and what's happened with, Plan G, the claims, the sky high rate increases and things like that. But I think one of the things that we need to really understand for our customers is to make sure they get the lowest cost Plan G for their lifetime. Okay. And that's really where the innovative G comes in, because I hear people going to CSG and, oh, Mike, I sell the cheapest thing on CSG. And then, Mike, a year or two later, they're out of business or they're taking 35, 40% rate increases. What's happening? Because the only people that benefit from the lowest price Plan G are, if they're turning 65, is if they die when they're 66. They got the lowest price for that year and that was it. But I think we should all in the industry look for how can we help our consumers have the lowest cost Plan G for their lifetime. And I think that's more important than just for that first year. So with the innovative G, it's really a hybrid of the high deductible G and the regular G. It's a hybrid. And what we did at Physicians Mutual is this. We all know that CMS is the one that creates the high deductible G, the regular G, the Plan F, the Plan N, the Plan K, the Plan L, the Plan A, right? CMS does that. what Physicians Mutual did is we patented this innovative rider and we attached it to a regular plan G. And that's what we did. And so what that really looks like is this. This innovative rider says this: for the first 3 calendar years, the customer is actually going to have the high deductible G. So with the high deductible G, we know that there's 2 true deductibles with the high deductible G. That's the Part A deductible is $1,736. So whether they end up in the hospital for 1 day, 10 days, 20 days, 60 days, they're only paying $1,736. That's it. If they have any type of outpatient services, anything done on a Part B basis, they're paying the first $283. And then we know they go into coinsurance. They pay 20% of the Medicare approved amount. And that's going to be key as we go through this, because once they hit $2,950 max out of pocket, they have 100% coverage the rest of the year. The Part A deductible goes towards that $2,950. The Part B deductible goes towards that $2,950. The 20% of the Medicare approved amount goes towards that $2,950. So we see is if a customer doesn't end up in the hospital as an inpatient, it's going to be very, very, very difficult for a customer to ever hit $2,950 out of pocket with just the $283 deductible and the 20% of the Medicare approved amount. And I'll show you some things when it comes to that 20%. So that's what's happening with the high deductible on that. So the first 3 calendar years, they will have the high deductible. And then what happens is this: it automatically goes away. It converts to a regular plan G the rest of their life at about 25 to 30% less than all the other plan Gs in the market. So that's what gives them that lifetime value, is by taking on this max out of pocket in the beginning in exchange for a lifetime of savings. So what I like to say is this: if you're willing to take on a temporary max out of pocket, or, some people will call it a deductible, but it's not really a deductible. The true deductibles are right here. But if you're willing to take on a temporary max out of pocket in exchange for a permanent lifetime of savings, then this plan may be for you. And I think all brokers should have it in their arsenal. Okay. So during this first 3 calendar years, I'm going to throw up a couple examples here. Let's say that maybe this is, let's say $50. Let's say this is maybe $110. Let's say this is $150. Maybe this is $180. I'm just throwing out some numbers. And so during this first year, let's say their effective date is in April. Okay. Oops, we lost my little pin. Let's say it's in April. So that means April through December of this year, they will have the high deductible plan. Okay. In the second year, January through December of 27, we know that Medicare or CMS will change the Part A and the Part B deductible. We'll know they'll change the max out of pocket. They do every year. They're going to have the high deductible again. And then in the third year, they're going to have the high deductible one last year. And then starting on January 1st of 2029, basically this innovative rider goes away, and now it converts to a regular plan G the rest of the customer's life. So if they're willing to take on this max out of pocket, they are going to be well off down the road when it comes to a plan G, because we all know people are hitting age 70, 72 now. Their plan Gs are skyrocketing to $350. They're calling the broker and saying, "Oh my God, Robert, can you do something for me? My premiums are going sky high and I never used the plan." Well, there's where this might be a good plan for them. Also, too, during this first 3 calendar year period, at any time during the calendar year period, the customer can actually write a letter to the company. And if they want to remove this rider and go to a plan G at any time during this 3-year period, all they got to do is write a letter to the company, cancel the innovative rider, and we will give them a plan G within 30 days. But what's going to happen is their rate is going to go up to whatever that plan G rate is at that time, is what's going to happen. So if they want the lowest cost plan G for their lifetime, they have to wait till January 1st, January 1st of 2029 to get the lowest cost plan G. But when you really think about it, this first year, unless your effective date is in January, you have 3 full years. But if it's not January, this first year is a partial year. So especially when you get people that might have a November effective date, that means they only have the high deductible for 2 years and 2 months. If your effective date is July, you only have the high deductible for 2 years and 6 months. So if it's April, you only have it for 2 years and 9 months. So that first year is usually a partial year. Then you have 2 full years. And after you do that on January 1st of 2029, it automatically converts to a regular plan G the rest of their life. And people love this. We have an unbelievable persistency rate on that. It's like 9 years. So people that buy the innovative, it's like they keep it 9 years, where a regular G, they keep it on average 3 years. So you can see the value that this brings. It's a hybrid plan that I say it's catching the industry by storm. There's all kinds of reviews out there about it. And the customers love it because they have the lowest cost plan G the rest of their life. Okay. So that's the innovative. I'd like to just share a couple things too. Let me just go through this real quick. And with this being said, just how that really works. Let's say that you had 2 twin sisters. One's name was Sandy and the other one's name was Molly. And so Sandy has a twin sister. She's turning 65. And Sandy's like, I'm going to buy that innovative G. It sounds really cool. I want to save money over my lifetime, but I'm going to take on that max out of pocket of $29.50 for the first year, and then it's going to go up the next 2 years. So she's going to take that. Maybe she's had HSA money. Maybe she's had, group insurance, but she's had a high deductible at work, or she's had ACA coverage, had a high deductible. So that $29.50 max out of pocket is really not that big a deal. But her sister Molly says, I want what all my friends say. All my friends say buy plan G. It's easy. I don't want to deal with it. So let's pretend that this Sandy's going to pay $100 for her innovative. But remember, has $29.50 max out of pocket this year. Her sister is going to buy the plan G, but she only has the $283 Part B deductible out of pocket. So she's going to pay $35 more than what Sandy will. And what I did here is this is just a hypothetical. It's just an example. Okay. And I raised rates by 10% a year. So 10% each and every year. So 100 to 110 to 121, 135, 148, 163. So you can see just in 3 years, Sandy has saved almost $1,400 in premiums that she could use towards her Part B deductible. Maybe she ended up in the hospital one time. She could use it towards that or towards the max out of pocket. But what's beautiful about this is this. At age 68, here's where we start seeing the savings. Sandy, now that high deductible G went away, right? The high deductible went away. And now Sandy has a regular plan G identical to her sister's G. The same exact G. Sandy's now paying $133 for her plan G that's identical to her sister, and her sister's paying $179, almost $180. So all of a sudden, for $46 a month difference, they have the same identical plan. Now Molly's not very happy with her sister Sandy because she's got a lot cheaper plan. Let's go out to 72. Look at this. $194 versus $263. Sandy's paying almost $69 a month less than her sister for the same identical G. And so this is where this lifetime of savings is really coming into play. And so what I did is I just took it out to life expectancy for a female at age 65 today. You would see that at age 80, Sandy would pay $417 for her plan G, the same identical G. Her sister's basically up to $564. That's $147 a month difference for the same identical plan. So in this hypothetical, what happened here was Sandy saved over $15,000 in premiums, over $15,000 in premiums over her lifetime in exchange for a temporary max out of pocket. So she took on this temporary max out of pocket for 3 years or less in exchange for a permanent lifetime of savings. And that savings in this hypothetical was $15,000. So you can see where this innovative G plan from Physicians Mutual really fits into a broker's portfolio for his clients so that they can have the lowest cost plan G the rest of their life, because this plan G here that we sell to is just like everybody else's G, is what happens. So with this innovative, that is a big, big deal. And one last thing that I really wanted to share with somebody today regarding the innovative, it's on the books 60% longer. Our company statistics, we came out with this plan in 2008. In 2008, so we have about 17 years of data. 97% of the people that buy the innovative G never, ever hit the max out of pocket in the first year. 97% never hit the max out of pocket in the first year. In the 3 years combined, 82% of all people who have bought the innovative plan over the last 17 years, 82% never ever hit the max out of pocket in any year. So whether it's year one, that's usually a partial year, the full second year, and a full third year, 82 out of 100 people that bought this plan never ever hit the max out of pocket in any of those 3 years. So people always worry about that stuff. Well, here's what I can tell most people is if you're going to hit the max out of pocket on this plan, they're probably going to have $3,000, $4,000, $5,000, $6,000, $7,000 out of their pocket with an MA plan. So what's the difference?
I was waiting for you to say that.
So you see that, and that's what happens out there that we all have to truly understand. Also, too, what I did was I went to Medicare.gov, and everybody can go to Medicare.gov. And you can go in there and look at the procedure price lookup tool. And what I did here was I came out with 6 different procedures that a customer maybe would have in a given year. Let's say I like to just start here at the bottom. If a customer had an MRI scan of their brain, including the brainstem before and after contrast, that was about a $1,200 bill from the doctor to Medicare. Here's the procedure code, so you can go out to Medicare.gov and look it up. Medicare allowed $296. That was the Medicare approved amount, the assignment amount. We all know that Medicare then pays 80%. So Medicare paid $237. Well, if you're the customer and you have the high deductible or the innovative plan, you're going to pay 20%. Or if you just had original Medicare, A and B, you're going to pay 20%. Well, that $1,200 charge, it's only $58 out of your pocket. So I'd like to ask a lot of the audiences that I present this to, with a standard MA plan, what would be the cost of an MRI before and after contrast, an MRI scan of the brain? And the answer is usually it's a $250 to $450 copay. Well, let me ask you this. If that's the case, well, this was only $58 out of pocket. Why not And I think this is part of the education that we like to do here at Physicians Mutual, to educate the person, say, hey, if you have an MA, here's what you can expect. If you had something like the Innovative G, here's what you could expect. And let's say you have a cataract surgery, okay? Let's say you had a cataract surgery. That's about a $5,000 bill to the doc, from the doctor to Medicare. Medicare approves $1,700. Medicare pays 80%. The customer would pay about $346. Now, remember, this would go towards the max out of pocket of $2,950. But if they had an MA plan, what would they pay? It's probably going to be $250 to $400 there for the copay. So maybe right about the same, or maybe a little more. And then I just like, oh, let's just run up to the colonoscopy. You know, where everybody gets colonoscopies, you do that with the removal of tumors, polyps, and lesions. And they did it by that snare technique. That's about a $3,000 charge. Medicare approved $874. Medicare pays the 80%, right, at $700. Well, guess what? The customer is only paying $174. Well, what's the copay on something like that? It could probably, for the MA, it's probably $150 to $400. So it's really not that big a deal when you think about it, and you compare that 20% of the Medicare approved amount versus what the MA copay would be. And most of the time, I would say this, most of the time, when you're thinking about it, what's the max out of pocket on the supplement here, on the Innovative or the high deductible? Is $2,950. What is the typical max out of pocket of an MA plan? See, I hear brokers all the time, they almost scare people like, oh my God, you don't want that plan. You could have $2,950 out of your pocket. I'm like, whoa, time out. The standard HMO PPO today is probably $3,900 to, I just seen one the other day with out of pocket is $12,000 is the max out of pocket on the MA. How does that compare to the $2,950? I mean, are you kidding me? But see, that's where I think this education, ladies, really, really comes into play.
Yeah.
Because when you compare the two side by side, the customer really gets to make an educated decision on what they purchase versus being peddled a product. You see what I'm saying?
Right. And you haven't even mentioned like networks yet. And like that's
yeah, I mean, I don't have to worry about networks. I got a nationwide network across America. I can go to any Mayo Clinic, Cancer Centers of America, MD Anderson. You can't go to all those specialty hospitals with the MA plans. And so that's the beauty. I don't have to worry about prior authorization or claim denials and all that stuff. I don't have to worry about that with the original Medicare and the supplement. So that's the beauty of our Innovative and why it works so well. And one last slide that I'd like to show, and then we could take on some questions regarding this, is this. Am I still sharing? Can you see it? Oh,
yeah, we can see it.
Okay. Is this. I think this is another one that is so important for everybody. Look at this graph. This is the Part A and the Part B deductibles of Medicare, okay? This is what it's been since 1990. In 1990, the Part A deductible was $592 because I hear people, they'll scare the customer and say, oh my God, you know, Medicare, CMS, they could raise these deductibles and these max out of pockets so high you can't afford it. That's a bunch of baloney. 1990, it was $592. Today, it's $1,676. So that's about, I don't know, what is that about? I don't know, $1,100 or so. I'm just using round numbers. Over the last 36 years, it's gone up a little over maybe $1,100, almost $1,100, $1,044, something like that, okay? So it's gone up, what on average? I don't know, $5 a year? Or $50 a year, something like that. Yeah, $50, $52 a year. It's gone up on average for the last 36 years, because today it's at $1,736. That's where my $1,144 was coming from. Okay. So if you think about it, it's gone up about $52, $53 a year for on average the last 36 years. I get a kick out of this one. Part B deductible was $75 in 1990. It's $283 today, folks. It's gone up 200 and what, $8 in the last 36 years. That's it. So what has it gone up? Maybe, I don't know, an average a little over $5 a year. That's it. That's the Part B deductible, a little over $5 a year that it's gone up. And then in 2002 with the high deductible, the max out of pocket was $1,620. Today it's $2,950. That's $1,330 that it's gone up over the last 24 years. Well, if we divide that into that, what is that? Five, that's about 120. It's about 130. Now it's about $55 a year that the max out of pocket on the high deductible has gone out. Remember, they're not going to, the government would be in big trouble. They only gave consumers 2.6% raise in their Social Security checks. So they're not going to raise this by hundreds and hundreds of dollars. Those people would be going backwards. So you see the 2870, which is now 2950 max out of pocket, is not that big a deal. I mean, I have a $4,000 deductible at work. I have another $4,000 of co-insurance. I have an $8,000 max. 80% of all people in America today have a high deductible health plan at work or an ACA plan that has a high deductible. That's a lot more than the 2950. So don't be afraid of this patented innovative G. It's a phenomenal plan for your consumers. Any questions for us?
We can open it up for questions. I don't see any in the Q&A box yet, but I think we were all very tuned into that.
Yes.
So, and you did a really great job, Mike. Like that explained it very well. So anyone that's still on here live with us, Kathy, Connie, Doug, Gary, James, Jeanette, Shirley, Sandra, anyone have any questions for this team? Anything at all about the Physicians Mutual Innovative Plan G? Please put it in the Q&A box so we can get them answered for you. And then I think y'all were going to talk about a bonus too.
Yeah. As we're waiting for questions, we can turn it over to Sandy. One thing that we did this year is increase and change our incentives. We do a monthly MedSup bonus. We always have, and we just made it better this year, which we're really excited about sharing with agents.
Oh, you're muted, Sandy.
Hopefully it's up on the screen. So yeah,
Yes.
We came out with a new MedSup bonus program for 2025. Probably I've been with the company for 16 years and probably the best bonus program I've seen us release. So we're really excited about that. Last year during AEP, you had to issue 7 Medicare supplements within a month to trigger our bonus. And for this year, we have lowered that down to 5. So if you issue 5 qualifying Medicare supplements within a month, then you've triggered the bonus. And how it pays out is if it's underwritten, we pay $200 for underwritten, unless it's undeductible. But this is actually the first year and for many years that we've bonused on the high deductible. It's such a low premium, but we're seeing more and more customers go with the cost sharing plans. So we wanted to make sure that we were bonusing the agents on that as well. So $200 if it's underwritten, unless it's a high deductible, and then it's $50. Any open enrollment innovative plans are $150. Now, if it's an underwritten innovative, it's going to be the $200, right?
Okay. I was going to ask you.
$25 for open enrollment high deductibles. And then all other open enrollments, it's going to be $30. Now, this is the first year that we've ever bonused on cross sales. So we used to have it that you had to have cross sales in order to trigger our bonus. We didn't pay anything additional. Now we will be paying some additional on our ancillary products. So if you've triggered the bonus with 5 qualifying issued MedSups in a month, and you have cross sales with your MedSups, we're going to bonus you on those cross sales as well. So if you have 1 cross sale with the MedSup, then it would be $25. So let's say it's a MedSup and a dental. If you have 2 cross sales with a MedSup, so let's say you have a MedSup and a dental and a cancer, that ratchets up to $40 per. So a total of $80 for those 2 cross sales. And if you sell all 3 of our cross sale products, which would be dental, life, and cancer, it would be $50 each for a total of $150. We do have some state specials out there in Indiana, South Carolina, and Wisconsin. Our bonus is paid monthly. It does have to be either underwritten or open enrollment, so there are some exclusions here. I know this is a lot of words on a page, so I'm going to try to simplify it for you and putting it into a graph. So you can see here on our underwrittens what we're going to pay. You can see on our open enrollments. You can see on the state specials. And then obviously we've got the cross-selling down here. So we're already in January seeing agents blowing our bonus program out of the water, which is really excited to see. You can go into a house when normally you would have made maybe $400 on a med sub sale. And now with the additional cross sales and the bonuses, we have agents making over $1,000 in a home. A couple things happen there. When you have more products with a customer, they're less likely to leave you. Your customer is better protected and you're making more money. So everybody wins when you cross sell. And sometimes with dental, it's as easy as saying, would you like your med sup with or without dental? Now, obviously it's a whole separate plan. And it does have to be written on the same day, same app date. So you couldn't write the med sup today and a month later write a dental. That would be really, really hard for us to track and tie it back. So, but we want to reward you for your cross sales and reward you for bringing business to Physicians Mutual. We know you have choices. And so we thank you guys for being appointed with us and having us as a part of your portfolio. And we would love to see you guys maximize our bonus program and qualify for our convention, which is in Scotland for next year.
Nice.
So you can build it based on how you issue business. And I know we're running out of time, so I'll be quick here, but you qualify for our convention by having 300,000 production credits. Seems like a big number, but it's really 75 underwritten med subs get you to our convention because we double the premium on innovative and underwritten. So if you had a $2,000 annual premium, you're getting 4,000 on an innovative or an underwritten towards your 300,000. So right there, 75 med subs is underwritten med subs would get you to our convention. And then our open enrollment plans, FGN and high deductible dental, cancer, life, all just count whatever the annual premium is. That's what counts towards it. So we would love to not only see you guys bonus, but we'd also love to see you in Scotland. That's all I have. Thanks for letting me step in here and finish up the meeting. And again, thanks for being appointed with us.
Yes, thank you for sharing that with us. And I think we do have a few questions, or at least one I can see here. Jeanette, we are going to send out a video so you can watch this again and you can go, rewind it as much or whatever you need to do there. And then Gary has a question regarding Plan N. He would like to know what the comparison is with Plan N with the Innovative Plan G.
This is what happens when you have 3 people on the line. We're all waiting to see who's going to go first. Hey, Mike, why don't you take it?
Go ahead.
No, you got it.
Well, I just wonder what I guess what I'm trying to get more out of the question is, okay, what do you mean by Plan N versus the innovative? Plan N, you got the co-pays and
Right.
And stuff like that, and you still got the Part B deductible with the Plan N.
Right.
But you could have excess charges and things like that too with that. But I'm trying to think. Can Gary can he have a?
Yes. Can you clarify that question, Gary? I mean, are you just talking about like maybe the premium comparison of what that looks like, or?
Well, and
premium
one thing
compare?
so one thing I would say is when we think about it, I think over the past 3 years, we've seen many carriers and many FMOs come out and really push the end because there was that premium difference. And I think that makes sense. But here's the thing. So many people that say go in if they're healthy. Is the client going to be healthy forever? Because putting them on the in is putting them on a plan for the rest of their life. They're going to be dealing with co-pays at the doctor and the emergency room. The difference between the innovative is you are taking on some cost sharing, just like the in, but long-term, you have a plan that grows with you that near the end of your life, you're going to have the best coverage possible. The other fear that I see in the industry, Mike did a great job of showing that, the Medicare approved amounts, right? The Medicare approved amounts, those are so low. And what we see is doctors looking at that and trying to find a way, I got to make more money. because that brain scan I just did on your brain, I didn't make any money off of it on Medicare. So eventually what you're going to have doctors do is they're going to start implementing the excess charge. And so that's the key. When you think about the implant, the implant says not only can we charge you 20%, but we can charge you an additional 15. And if you're on the end, we're not paying for it, the carrier. So that's the fear. So I get it. The other thing with the end is what we were told is let's sell the end because the end's going to have a lower rate increase. Did everyone see what happened last year? The end plan was getting the same rate increase as the G. So that's not the answer moving forward. So that's how I would answer that question. Final thing, because Sandy and Mike got to talk so much. So 3 things wrapping up. I think Sandy's spot on. Go out there and write 75 med subs, go to Scotland. And not only that, but you're doing the right thing for your client. And I think that's what we have to think about moving forward is we as agents need to take more of a needs-based approach. And that means a couple things are going to happen. You're going to help your client even more. And that's going to come through cross-sell. So definitely, maybe I'm putting a little plug in for Eldercare right now. But we have a phenomenal tool called the retirement checklist. And it just helps agents do a needs analysis with their client. It helps them increase their cross sells. And with Physicians Mutual, you saw the bonus. It's going to increase your income too, putting more products in the house. So moving forward, we'd love to do a secondary training. Have Mike come in. The retirement checklist, I think he actually did create that. He didn't create the innovative, but he did create the retirement checklist. And he's the man when it comes to our ancillary products. So take a look at our ancillary products. Hopefully we can come back again and maybe do a training specifically on our life, our dental, and our cancer, and explain how to be needs-based moving forward. Final thing, and I know I'm out of time, is if you don't have a contract yet with Physicians Mutual, get a contract with Physicians Mutual. We appreciate you. We appreciate Eldercare.
Awesome. Thank you so much, guys, for taking the time to talk to our agents. If you are interested in getting contracted with Physicians Mutual and with Eldercare,
we will be calling you.
And if you're watching on the recording, what would they need to do?
You can comment on here, but we are going to reach out to everyone. Make sure you don't have any additional questions. Make sure we can get anything answered that you may have after this. And if you're not appointed, then we will get you a contract out today.
And Jeanette, we always put our recordings on our YouTube channel. If you're watching this on YouTube, you can call us at
800-777-9322.
Yeah, and we'll be happy to help you. And Mark and Connie, I do see your questions and we'll follow up with you on those. But we're going to give everyone their day back and y'all have a great rest of your week.
Thank you guys. Have a great
Thanks, everybody.
Thank you. Have a great day.